So we'll quickly go through both the Ontario and the Niagara situations again. The Ontario situation looks like lots of good news. We can see that their case trend since it's peaked in the third wave has been consistently coming down. And actually Ontario cases now are actually the lowest they've been since the end of September. We're back down to a weekly cases per 100,000 rate, similar to where we were actually on September 30th. So that's really good news. And hopefully we'll still have a few more days of this coming down before we start to see the impacts of the step one reopening. And hopefully that step one reopening's impact will actually be very little. So we'll continue to see a downwards trend from there. Just showing you what the reproductive number looks like. Of course, with cases going down, you'd expect that that reproductive number remains below 1. And it clearly does remain below 1. And in a good news bit, it seems to be continue to trending even lower. So that means the province is set up that even if there is an increase due to the step one reopening, hopefully we've driven down the reproductive number province-wide on average so low that it'll be able to absorb that and it's not going to delay the province moving to step 2. Hospitalizations in ICU occupancy looks really good as well. We can see hospitalizations has consistently come down, and hospitalizations are now, I think, somewhere around where they were back in November. And if you look at ICU capacity is barely lower than actually hospitalizations at this point, implying that actually we've managed to clear out most people from the hospitals, except those needing the most intense care at this point. Unfortunately, those people who do need ICU care is still higher than we were at the peak of the second wave, getting pretty close to being able to get below that, but it still illustrates, I think, that our hospitals are still stretched. They still have a ways to go to recover from this past wave. Modeling is pretty promising going forward. You can see that, it does look like we can expect cases to continue going down for another week or so in the province. And then there's a few scenarios here. They're red, yellow, and green, really around, how much social activity results from the reopening and what happens. In every scenario, there is an increase. Of course, the red one, there's a big increase. The yellow one, a more modest increase. And the green one, there's just a tiny blip. And then, in all of the cases, that increase starts to level off, or in the green one actually come down. My hope is that with the step one reopening, there's only a little bit increased potential for infection to transmit. So we basically go on this green trajectory, and it is maybe step 2 or step 3 that puts us on that red trajectory. But that red trajectory will be starting from a point where we have more vaccines out, cases are lower. So we won't see that same kind of jump, hopefully, by the time we do see that level of social activity going on. I mentioned it'll take a while for our hospitals to recover, and this is the modeling showing what's going to happen with the ICUs. And actually, the green, yellow, and red lines are pretty much all superimposed here. So showing that it's going to take quite a while, even getting to mid-July. Our ICUs will still have about 200 people in them, and the province used to say that their danger threshold was 150. So our ICUs are going to need quite a while to recover, with things hopefully continue to trend downwards. Switching over to the Niagara story, it's a little less positive here. So, we are seeing a really good decline of cases until last week. And I mentioned at last week's briefing that we're starting to see a bit of a flattening out. And that flattening out really carried through really the entire week. And you can see here that our cases are pretty flat. Good news, of course, is today we had a relatively low case count, and that seems to be pulling the average back down. And we'll see what happens over the next few days. I am hoping that maybe this was a short-term blip, and we'll hopefully be back onto seeing a downwards trend, but we'll only know with a test of time. And I am worried that there was a flattening out when the rest of the province continued to see a decline. And I think we need to be very mindful of what happens here in terms of our readiness to keep going through future steps of the reopening plan. That flattening out can kind of be seen with the reproductive number here, where of course we want to be below 1. And we were consistently below 1 for most of this third lockdown. But you can see we started to hover around 1 for most of last week, which is really consistent with our cases flattening out, not coming down. Today, of course, it seems to be dropping back down again. And so, as I said, hopefully that's something we'll see continue on. When we look at the hospital and ICU occupancy here in Niagara, with hospitalizations, you can see our hospitalizations have really sort of flattened out. They haven't continued to come down. which is sort of consistent with the cases flattening out for a little bit. Hopefully we'll see the hospitalizations start to come down again soon. And with ICU admissions, you can see they came down to about half of where they were, but it's been pretty flat since then. That's probably just, it takes a few weeks for people who unfortunately had to get ICU care before they're able to come out of the hospital. So hopefully that is something that we'll see start to come down over the next few weeks as well. Just looking at a quick breakdown of cases by age group here, because I think this is really useful to see. So just drawing in the 5 different age groups here. Key message I mentioned before is that if you look at our 2 eldest age groups, they're the ones with the fewest cases of COVID-19. Even in the peak of the 3rd wave, they've had fewer than other age groups, which wasn't the case with previous waves. And that's really, I think, the impact of vaccination. What I am seeing is that this 20 and 30-year age group, they are the ones that remain the highest in terms of cases and really have been throughout this entire wave. And that's, of course, where we have the lowest vaccine coverage. And so that's a group that really needs to be a priority for us going forward, to try and get them vaccinated so that we don't see them really sticking up. Because if there's any sort of resurgence of COVID-19, I think it'll probably be amongst that younger age group. And I'll come back to that in a moment here. Just looking at our weekly tests for COVID-19, which I've showed you in past weeks. And I've actually moved to a provincial database this week that looks at about over 90% of the tests done in Niagara. It doesn't quite capture every single provider doing tests, but it's the vast majority of them, which is a shift from last week where I was looking only just at the tests done through Niagara Health. So this will capture tests done in primary care, in urgent care departments, in long-term care homes, etc. And you can see that we do see that downwards trend in terms of testing being done, which should happen as we recover from this wave of COVID-19. We're not expecting as many people are going to be getting sick and needing to be tested. But that number of tests, if you look, is similar to where we were in July and August last year, which is when we had 1, 2, 3 cases a day. And so I do think our number of people being tested right now is relatively low for the number of cases we have. And I think it's really important we get more people signing up for testing in the next few weeks, because that's how we're going to control COVID-19 going forward. We need people to be tested when they have any mild symptoms, so we can pick up if they have COVID-19 and use contact tracing to try and slow the spread of infection. We need to rely more on contact tracing and case isolation now, and less on lockdown measures as we start to reopen. And so making sure we have the testing done so we can find those cases and do that case isolation and contact tracing is going to be really important. And that, I think, starts with continuing to get the message out there that people really need to be, once again, mindful if they have any mild symptoms of illness, and making sure to get tested, even if they've been vaccinated, because even if you've been vaccinated, you can still sometimes get COVID-19, and we don't want to be missing those cases. So a big theme the last few weeks has really been on the variants, and particularly around the Delta variant. Overall, the variant picture in Niagara really hasn't changed a whole lot. We do have one more Delta variant case. We've got actually a couple of the Beta variant, which was the B1351 variant that came out of South Africa that we definitively identified. And then there's one more of the Gamma variant, the P1 variant. Both of those, I think, are pretty much expected. We've seen quite a large number on screening that we know is going to be one of those, and we're just starting to see some of those we definitively identified. Unfortunately, we haven't seen a big increase in the Delta variant. But as I talked about, we don't have every test of COVID-19 or every positive case of COVID-19 in Niagara being tested for this routinely. So we are a little bit blind into how much true Delta variant there is. The UK, of course, is where they're suffering the most with the Delta variant, and the data coming out of the UK is increasingly showing that this Delta variant is more transmissible than the previous versions of COVID-19. And it's probably about 50% more transmissible than the Alpha variant, which is the dominant variant right now. So that does mean it's going to be harder and harder over time if that Delta variant takes hold to control it. But they're also seeing that there's greater severity for the Delta variant, and perhaps more people are more likely to be hospitalized if infected by that Delta variant. And so that is some concerning data, of course, if we do see the Delta variant take hold here. In the UK, the Delta variant very much has taken hold. So this is a graph showing, 100% of tests at any point in time. The pink color was the Alpha variant, which is, of course, originally in the UK, and we've seen really dominating cases. And then the purple here is the Delta variant. And you can see that the Delta variant really just has taken over and is upwards of 95% of the cases in the UK right now. And this has really just occurred over the course of a couple of months. If you remember, even last week, I think we're closer to 75%. The week before that, we were around 60%. So this has really just grown very rapidly in the UK. And I think that's the big concern we have with the Delta variant, that it's not yet looking like a lot here, but there's always a potential it could grow very rapidly here, similar to what it did in the UK. And then we're dealing with a version of COVID-19 that's going to spread more easily, so be more difficult to control, and is going to cause more hospitalizations. Looking at the Ontario data here, I've talked about how since cases aren't being routinely tested for the Delta variant, it's actually really when we don't see any variant identified, that's probably undetected Delta variant. And if we take a look at what the trend here has been in Ontario, you can see that cases that have had a variant identified have been declining really since the start of May. And it's unfortunately looks like it's accelerating a little bit. And probably this gap here represents undetected Delta variant. And unfortunately, as we can see, that Delta variant is probably on the order of a good 15 to 20% of cases now in Ontario. And it does seem to be picking up. Most of those seem to be in parts of the GTA, in Waterloo, Porcupine Health Unit up north. It doesn't seem to necessarily be in all parts of the province yet, but of course, given it's in the GTA, the proximity to us is very near. The good news here in Niagara is that if we look at a similar graph here, we don't actually see that kind of pattern. A couple of weeks ago, I was really worried that we were seeing the Delta variant growing, and because there was this big drop in cases where we knew there was a known variant. But that seems to have reverted back to being closer to 98, 99% of cases have a known variant identified. So we're probably not seeing a lot of Delta variants circulating right now. One of the things we did around mid-May, knowing that cases there were no variant was identified could be the Delta variant, is that we've actually done more intensive contact tracing with them. So any case that doesn't have a variant identified goes to the top of the list for our follow-up, so we get to them immediately. We're being more aggressive about isolating cases and contacts with them, and in some cases, even extending the isolation in cases where we're particularly concerned. And perhaps that has been one of the reasons why we've been able to kind of squelch out the little bit of Delta variant that maybe was appearing here and really go back to probably not having much Delta variant around. So that's certainly good news here in Niagara. Going back to the UK, though, I think we can see what would happen if the Delta variant took hold and continued to grow the way it is in Ontario. And this is looking at the breakdown of cases across many different areas in the United Kingdom. This gray color being the Alpha variant, which was a dominant variant before, and then the red is the Delta variant. And you can see in lots of places, particularly the northwest of England, places like Bolton, Blackburn, Bedford, even Salford, you're seeing the Delta variant really take off in these areas. And even places like Greenwich, which are more central, or Ealing, you can see that while it's not taking off in the same way, it is definitely reversed a trend of declining cases to now being a trend of increasing cases. And that's, I think, the risk we could potentially have here if the Delta variant took hold. I should remember that UK does have higher second dose vaccination rates here than we do in Ontario. So they do have a lot of vaccine out there. They're one of the world leaders in getting vaccinated. So they, despite having vaccination, are seeing these increases in cases thanks to that Delta variant. Just taking a look at what this has done to the overall UK case count. You can see they brought their cases down through an extended lockdown that really began in mid-December. But late April, May, as that Delta variant was picking up, their cases really flattened out with that Delta variant growing underneath. And you can see there's been quite a sharp increase over the last couple of weeks here where cases start to go up rapidly again in the UK. That trajectory you can see is almost similar to, the speed at which it was rising back in the fall before they went into their second wave. And so it does look like there's a chance the UK might be headed into a fourth wave due to that Delta variant here. And just to give you a little bit of perspective, I'm just going to draw in what the Ontario case curve looks like here. And you can see how much, higher that UK case curve is. It's a little over 100 cases per 100,000 per week, whereas in Ontario, we're getting down under 30 cases per 100,000 per week. So it's almost 3 times higher where the UK is right now in terms of its daily cases. And they're unfortunately again on that upward trajectory. Of course, this is zeroing in just on Northwest England, where the Delta variant is most strongly there. But you can see with cases, with Delta variant cases going up, we're also seeing hospitalizations starting to go up as well in that region. And that's, I think, expected that if you have more cases, you're going to get more hospitalizations. And so that could potentially be a risk here if we don't manage to hold the line on the Delta variant, especially worrying since our hospital sector, as I showed, hasn't completely yet been able to recover. I talked earlier about the concern around vaccination rates in younger age groups, and where younger age groups still seem to be where most cases are. And actually, if we look at the United Kingdom here, you can see that the Delta variant is actually pretty flat with older age groups. It's actually maybe even declining a little with the oldest age groups. It's mostly growing in the younger age groups. And I think that is a reflection that, like in Ontario, the UK is seeing lower vaccine uptake in that younger age group, so they remain more susceptible to COVID-19. And all along, they've unfortunately been the group that's been more affected by COVID-19 in terms of having more cases all along. So I think making sure we get this group vaccinated, and really the youngest part of that group, is going to be really important to make sure we control the spread of COVID-19. I talked about research in last week in the UK showing that the one dose of vaccine for the Delta variant seems to be a lot less effective. And this was data put out by the Science Table last week showing that with the Alpha variant, 60% of people with one dose are going to be protected, and then that second dose is topping you up to get to 90%. With the Delta variant, it's more like 30 to 40% of people are going to be protected. So over half the benefit of the vaccine is going to come from that second dose in terms of protecting against the Delta variant. And in Ontario, where we've taken a first dose strategy, which I think was the right strategy, we got more people having this 60% protection to the Alpha variant, making sure we got twice as many people getting this much protection rather than just using up half our doses to top up half the effectiveness. I think it was a good strategy, but now with the Delta variant, it's going to be really important we get those second doses up as well to make sure that before the Delta variant really takes hold, we have a lot of people, in particular our oldest group, is at greatest risk of severe outcomes, to be vaccinated with 2 doses. The provinces, I think, taken hold of that, and they've looked at where are the hotspots with the Delta variant, and they're actually going to, as of today, expanding eligibility to get that second dose to more people in these hotspots with the Delta variant, to make sure where the Delta variant is spreading, we can get much better immunity against it, and hopefully actually be able to contain in these areas and prevent it then from spreading to other areas. And we can see, as I showed, Niagara doesn't really have much Delta variant, it looks like, so that's good news. But of course, Halton, Peel, Toronto, even Waterloo and Guelph aren't too far away from us. And so there's a potential that people traveling from those areas could bring infection here and let the Delta variant start to spread here. In terms of our vaccination coverage, I think we're really seeing a shift starting really probably yesterday of most of our appointments being now people coming for their second dose as opposed to their first dose. And so if we look at the breakdown of our vaccine coverage here across age groups, we can see that our 80+ age group, now we've got over half of them getting their second dose. And we're starting to see some increase in some of our other seniors starting to get into the higher numbers of second doses, where back a couple of weeks ago, everybody was around at 5%. These numbers are starting to get into the 10, 15, 20% range. Over 10% now of Niagara residents do have their second dose. But I think the expense of lots of people having bookings for second doses is that there's fewer people booked in to get that first dose. And particularly these younger age groups where, we're only around 50% or so of them vaccinated. I think we're going to need to do some dedicated outreach to try and get these percentages a little bit higher, because this is a group where the Delta variant looks like it takes hold, and we want to make sure that they get at least that first dose of vaccine and then that second dose of vaccine, so we can make sure they're protected. One thing I think we need to be mindful, though, is that as much as getting 2 doses of vaccine is going to protect us from the Delta variant, it doesn't look like that alone is going to be enough to keep us safe from the Delta variant. And outbreaks can still happen even though people are vaccinated. And, one outbreak that I'm looking at is actually over in Calgary in the Foothills Hospital there. And they have 16 patients in this outbreak who are COVID-19 and who are infected with the Delta variant. And actually 6 of those 16 patients had 2 doses of vaccine. 7 of them had 1 dose of vaccine. Yet all of these patients have unfortunately become sick with the Delta variant. And one of them is actually in ICU as well. If we're looking at healthcare workers who, of course, would be older, younger, probably have been a bit better health. Even with them, 5 of the 6 healthcare workers who've been infected actually have 2 doses of vaccine, and the other one actually had 1 dose of vaccine. And so even with vaccination rates getting up, we are still going to see cases of the Delta variant. We're still going to see, unfortunately, spread of COVID-19 a little bit. And so going forward, it's really going to be a combination of vaccination, but some ongoing due diligence by all of us to do what we can to keep ourselves safe from COVID-19, because the vaccination on its own isn't going to be enough. It's really going to be a combination of those efforts. But hopefully what the big difference of vaccination does is it means we don't need to go into lockdowns. It can be voluntary measures in much more modest restrictions, maybe occasionally, that's going to keep cases under control. Just want to highlight the situation here with Porcupine Health Unit, which I just showed was one of the hotspots where the Delta variant is spreading. And if you actually look at the case trend there for Porcupine Health Unit, that they had their first wave, their second wave, and their third wave, unfortunately, has never really ended. And they seem to be near the peak of their third wave still. And so while the rest of the province has been able to bring cases down, they unfortunately have not. And that is, again, linked to that Delta variant. And I think that really highlights some of the concerns of the Delta variant, that even despite lockdowns, even despite getting vaccination rates up, and Porcupine's vaccination rates are really similar to any other part of Ontario, they are still susceptible to seeing a big wave of cases. And there's still the possibility that could happen with us if we're not still cautious going forward. Just to give you some comparison of what this looks like. Sorry, that is disappearing there. I'm just going to go here to Peel then. And you can see Porcupine's cases right now per capita are very similar to where Peel's cases were per capita at the height of their third wave. And that is, of course, where the basically epicenter of COVID-19 has been in Ontario. And that shows, I think, just how difficult this wave is for Porcupine right now. And I think highlights, that we're not in the clear of seeing these sorts of waves quite yet. Last thing I want to do just before I open up for questions is, I think there's been a lot of talk about the US, and the US hasn't really been showing the same level of caution with reopening that we have here in Canada. We have a very phased approach to reopening. We're not stepping away from wearing masks quite yet. Where in much of the US, it looks like they're really seeming to starting to return to normal. Part of that could be explained with their vaccination rates up. Another part is, of course, they've seen much higher cases of COVID-19 all along. So there's probably a lot more natural immunity there. But if we look at the US case trend, I think it is a little bit interesting what we're starting to see. So, they were seeing the cases come down, but lately you can actually see their cases have actually flattened out and have stopped coming down. And just like Canada, they would be susceptible to the Delta variant starting to spread. Unlike Canada, the US actually doesn't have the same quality of testing for COVID cases and ability to identify variants that we do. And I'm worried that what might be happening in the United States here is that they had a downward trend of cases, but underneath the surface, that Delta variant has been building up. And just like we've seen here, and I've talked about before, they'll see cases go down for a while, they'll flatten out, and then they'll start to go up. And I'm going to be watching very closely to see is that what happens in the US, that they start to see cases go up? Because that could mean that right across the border, we have a lot of Delta variants starting to spread and starting to spread uncontrollably. And that could be a potential risk for us if there is a reopening of the border in the near future. I think it is, interesting that we don't really have a sense of what's going on with the Delta variant south of the border. And I think there is some evidence that maybe that Delta variant is taking hold and they haven't seen it yet. And they're not really taking a caution that's going to make sure that they keep it under control going forward. Just to compare with what that US case trend looks like compared to Ontario. So, it was known that during this last wave, the US actually was doing better than us here, but that's actually reversed and they flattened out while Ontario's continued to see cases go down, and the US again has more cases than we do here in Ontario. And we'll see what happens in coming weeks around that trend. So with that, I'll stop and turn it over for questions.
Okay, thank you, Dr. Hergy. So up first, we have Penny Coles. Penny, you should be able to unmute now.
Thank you. I just would like to talk a little bit more about vaccinations and their availability. You're encouraging people to sign up for first doses and second doses. I'm hearing just from the community, there is a difficulty getting vaccinations through the provincial booking system, and also with pharmacies who don't seem to get us a consistent supply. So what can we expect to happen?
Yeah, no, I think you're absolutely right that there's been a lot of enthusiasm for people, particularly older people, signing up to get their second dose as soon as they had the opportunity last week. And so we have some 30,000 people booked in with either Public Health or Niagara Health over the next couple of weeks. And that's really taking up almost all the appointments available. My sense is pharmacy actually is getting a relatively consistent supply, but not a large enough supply that they would like. They have more capacity to deliver vaccinations. And like us, I think people are very quickly signing up for those doses. So it's hard to get that dose. Something's coming down the pipeline is that we are adding additional appointments to some of our clinics over the next couple of weeks. So, we'll do a press release as soon as those are up, so people can have a look out for those when they go up. I believe Niagara Health has just added some additional appointments, so there might be some availability for them. Then we're also adding appointments for the first week of July, so those should be available in the next few days as well to add some more appointments. And then finally, we've heard from the federal government that there's a big shipment of Moderna coming into Canada by the end of this month. And I think that is going to, of course, roll out to us in local public health and the hospital. And so we will probably see some additional appointments coming online very soon. So, unfortunately, at this very moment, there probably aren't a lot of appointments, but my hope is that by even, a few days from now, there'll be some more appointments. And I think there'll be a lot more appointments opening up over the course of the rest of the month. So, really encourage people to be on the ready so that as soon as vaccine appointments are available, they sign up.
And a follow-up, Penny?
No, that's good. Thank you.
Okay, thanks. So up next, we have Paul. Let me just find you on the list here. There you go, Paul. I can't hear you, Paul. Okay, we'll come back to you, Paul. Okay, up next is Gord.
Hello, everybody. Dr. Hergy, you mentioned the cases in Calgary where people with first and even second vaccinations are still getting sick. Do you have any data for Niagara as far as first or even second vaccinations that are still becoming sick? Like, are you seeing much of that?
I can't say you've seen much with people who've had 2 doses of vaccine. There might be a few cases. I need to double check. We've definitely seen a fair number of people, well into the mid-single digits at least, into the 30s, 40s number of people who've had 1 dose of vaccine and unfortunately gotten COVID-19 over the course of the last couple of months. definitely would say it's a minority of our overall cases, but it's not an insignificant number overall. And we would expect that, of course. The Alpha variant, the vaccine is 65% effective at preventing illness. So it's not surprising that there would be some infections from that still. I think it's just a reminder that no vaccine is going to be 100% perfect. As new variants come on the scene, the vaccine wasn't really designed for those variants. They're designed for the version of COVID-19 we had back in the summer and fall. And so there's always going to be potential that our vaccines aren't going to give us complete protection. And that additional protection is going to come from keeping distance, wearing masks, washing our hands, avoiding big crowds, continuing on with some of that due diligence going forward, or at least a little while longer.
And a follow-up, Gord?
And also you mentioned you might look into a dedicated outreach to get some of the younger people who aren't signing up. Presumably they're getting a lot of information already because there's a lot out there and they're just choosing not to do it. How do you reach them? Like, do you do lotteries like some of the other provinces are thinking of? Like, how do you get through to them?
Yeah, the lottery idea is a little bit odd to me. I don't fully understand the motivation behind it. But I think what we first need to do is really understand that group that we're dealing with and what their motivations are. As you say, there's a lot of information out there, so it's probably not a lack of information. We do know that some young people are less deferential to authority, more questioning of recommendations coming out of government. So perhaps there's some of that mistrust we need to work through. It's also possible, and we've seen some data supporting this, that a lot of people who are less likely to get vaccinated are actually people who are of lower income, who have families, and maybe they're just busy. They've got a lot going on in their lives. They're working to make sure that they can pay their bills. They're of course needing to deal with homeschooling right now, given that a lot of the responsibility on teaching has been fallen onto parents because in-person classes aren't going on. And maybe when they sign up for a provincial portal and there's no vaccine appointments for 2-3 weeks out, they can't really plan that far ahead just given the situation in their lives, and they need to get to a point where we're able to give much more real-time bookings or same-day bookings for them. These are some ideas. There's probably pockets of population that fit with all of them, but I think we really need to first understand the population we're dealing with a little bit more. We're going to use some of our data around market segmentation to understand that. We'll also perhaps do some surveys to better understand the population. And based on that, we'll figure out what's the strategy that's going to work to engage them.
Okay, thanks, Gord. Up next, we have Richard. Over to you, Richard.
Hey, everybody. Actually, I just have a question about cases in Niagara-on-the-Lake. I know cases seem to be going down other places, but they've kind of been at a standstill in Niagara-on-the-Lake, and actually I think went up by 1 today to 16. Do we have any sense where those specific cases are coming from?
Yeah, unfortunately, I don't have any information on that I can share with you at this time. I don't believe there's any real outbreaks right now linked to Niagara-on-the-Lake. So it would be cases out in the community. I can follow up with the response later to give you some additional details if there's any pattern we've seen with the Niagara-on-the-Lake cases. Okay, sounds great. That's all I have for today.
Okay.
Thanks.
Thanks, Richard. I'll turn it back over to Paul to see if your mic's working. There you go, Paul. Sorry, still can't hear you. Do you want to type it in the chat, or you can send us an email afterwards? Try the chat. In the meantime, Gord, did you have another question that you wanted to ask?
Yeah, one more, thanks.
Sure.
As you know, on Friday, the elected officials made pretty clear how they feel about Section 22. I wonder, are you hearing the same thing from business owners or people in the public? Either the same thing or the opposite, that they support? Like, is there a lot of talk of that? And I wonder if you project ahead, how much longer before that might be able to be lifted?
Yeah, definitely, I think the business community who operate food service sectors aren't very happy about the Section 22 order. My sense is, they're disappointed, but most of them are going to follow through on it, given that they're responsible operators. I haven't heard as much from the public, and I think there's sort of, to the extent I've seen the reactions on social media in the public, it's really been a mixed reaction. Some people are, understand the need for caution. They want to be careful going forward. Others don't quite see why things are different in Niagara and why we would be exercising this caution. I think around the province, we've seen different areas have brought in orders for different reasons. Ottawa has one in recreational facilities. Sudbury's actually adopted a similar order to what we have for food services. Hamilton, Toronto, they've got orders on workplaces. There's many other examples. And then Porcupine would be, I think, the special case where I showed you how high their cases are. They've actually instituted orders to basically reimpose all of the lockdown measures in their region because they feel they can't take the step one of reopening right now. So, I think based on what we see locally, we all as Medical Officers Health try to customize what might be needed as additional measures here. And I think in Niagara, we felt that given our cases have kind of flattened out and we're actually above average now in the province with our cases, we need to be a little bit more cautious than elsewhere. And we've seen this in an area where we've seen outbreaks in the past. As our cases come down, we would definitely look to be lifting this. If you have fewer cases in the community, your risk of getting COVID-19 from social interaction with others is going to be lower. It could be even as early as a couple of weeks from now that could happen, but it's really going to depend on what we see with the case numbers. We're not going to set arbitrary timelines divorced from what we're actually seeing on the ground.
Okay, thanks, Gord. Penny, do you have another question you'd like to ask?
Sorry, I had to unmute. No, thanks. I'm good, thanks.
Okay, great. And Paul, do you want to try one more time? Nope. It's not your day, Paul. Just shoot us an email afterwards and we'll get your questions answered. Okay, so that does it for this week. Thanks everyone for joining us and we will see you next week. Thank you.